Welcome to the Shatkin F.I.R.S.T Monday Morning Minute. Good morning and welcome to the Monday Morning Minute. We have a special edition of this Monday Morning Minute this morning. We have the good fortune of being with Brittany. Brittany is Dr. Shatkin's financial coordinator. And at Shatkin F.I.R.S.T during the week, we get a ton of calls about financing. How are we going to finance the patients to be able to afford the procedures that we're offering? And Dr. Shatkin, he does a lot of fixed cases, he does a lot of overdentures, he does single teeth, but it's so important to have the ability to do some financing, right, Brittany?
Right.
And I know that we were discussing earlier, when Dr. Shatkin does the financing, he likes to have the patient in the chair, and he'll pull a computer right up to the side of the chair,
Right.
and he'll do most of the work. But can you tell us, basically from step 1 through 10, or what have you, how does it go step by step by step for to get a patient financed?
Yeah, absolutely. So after Dr. Shatkin presents the patient with the treatment plan, we always say, and we do offer financing here in our office, and we can do 2 years no interest, which that attracts a lot of patients, or we can extend it up to 5, all the way up to 12 years.
Okay.
So
is the most you can go 12 years?
12 years, yes.
Okay.
12 years is the top that you can do. And then if the patient wants to do the pre-qualification application, we always let them know we can do the pre-qualification application. It's just a soft credit check. And then if we're pre-approved, we'll go from there.
Gotcha. So the soft credit check on the pre-approval.
Yes.
Gotcha.
Yes.
So, and do you let all the patients know that?
Oh, absolutely. We just always inform them it's not going to affect your score. We're just going to do the pre-approval.
Okay, gotcha.
Yeah.
And then say they're pre-approved for the procedure, and let's say Dr. Shatkin's doing an upper roundhouse. Take us from that step on.
Yeah, so if they're pre-approved and say they're financing, a lot of patients do upper and lower, so that's going to be, the price of $40,000.
Okay.
So a lot of patients are interested in doing a longer term. So then say they find the term they're comfortable with, we'll go ahead and select it. And then we always like to tell them, once we put this loan through, it's going to do a full hard credit check.
Okay.
And then we get their permission and we select the term, and then they sign, and that's it.
Okay.
Yeah.
And how is the application? Is it a large application? What do they basically need from the patient?
Their basic information. They'll ask their employment status, some income questions, if they have like a monthly rent or mortgage payment. And that's basically it. It's very short and quick and straight to the point.
And how long would it take you if you're starting from the very start of the application to the very till we know that the patient's been approved?
Oh gosh, maybe like a minute or two.
Just a minute.
Yeah.
Okay, so it's relatively quick.
It's very quick. Yeah.
I see. Okay. Could you give us a percentage of the people that you guys finance here, like of the patients?
I would say like a great deal, because patients just like the fact that they have as many years as they want to pay it. And then there's no prepayment penalty. So if they want to pay it off sooner than the term they select, they won't be penalized for that.
Oh, gotcha.
Yeah, so
okay.
that's always a good thing to let them know too.
Yeah, that's awesome. And as far as when the patient's done and they get approval, does Dr. Shatkin start the work right away, or do you set up another appointment?
He can if there's time. If it's something that isn't as extensive, he might start the work that day. But then if it's something where he needs, more time, then he gets them in really quickly.
Okay.
Yeah.
Okay.
He does his best to accommodate to the patient's schedule.
Oh, okay.
Yeah.
And so I know that Dr. Shatkin does a lot of Care Credit. But
Yes.
how many other financing companies does he work with?
Aside from Care Credit, we have 3 other companies. We have Lending Club, Proceed Finance, and Allegro.
And Allegro. Okay. Is there one financing company that you like to use over another for any specific reason?
Honestly, I always, when I have the patient in the chair, I kind of do the pre-approvals for every company to get them the best rate. Because each company sometimes have different rates and terms. So I try to just find them the best price and the best interest rate if they're going over the 2 years with no interest term. Yeah, I always like to compare all of them.
Okay. Wow, that's very nice. That's great.
Yeah.
So you know that the patient's getting the best rate
Exactly.
that they possibly can for that term.
Yes.
Oh, okay. That's awesome.
Yeah.
So, I would say, I know at the courses that we have, Dr. Shatkin and a lot of the finance people who offer the financing, they come to our courses, which is helpful. And they always talk about, what the interest rates are and how the patient can benefit. So, do you think there's anything else that we need to tell anybody out there about, like, what the importance of financing, or is there something that we didn't touch on that would be helpful?
I just think it's important to let the patient know that, when they're getting their treatment plan, the price might kind of be like a sticker shock. But then when we present them with their pre-approval and how they can go up to 10 years or 12 years, they'll kind of see the payment right there and they'll be like, okay, well, $300 a month sounds better than $40,000 right down front,
Yeah.
And then we always just try to find a payment that's comfortable for them and work with them, and just so they have the time to pay it off and can afford it monthly for them,
Yeah, that's, I mean, it makes perfect sense,
Yeah.
right? And when you can push the payments out, that's very, very helpful as well. And the longest you could possibly go is 12 years?
12 years, yeah.
12 years, okay, I see.
And that's with proceed finance.
With proceed. Oh, okay,
Yeah.
okay, awesome.
Yeah.
Well, thank you so very much for sitting down with us this morning. It was great talking to you.
Yeah, you too.
And you're an expert, I know, because Dr. Shatkin speaks so highly of you all the time. So, yeah.
Thanks.
So, thank you so much to Brittany for helping us out.
Yeah.
I would like to thank all the doctors and staff members that came down to Disney for our course on the 4th and 5th of August. It was absolutely awesome. We met new people who are getting into the one-piece minimally invasive implantology, and the lectures that we had, Dr. Petrowski, Dr. Lasorsa, Dr. Shatkin, absolutely phenomenal. I mean, we've gotten so much positive feedback, and we're so excited. We're having our next course in September, and it's a beginner's course. It's on September 20th, which is a Friday, and the 21st, which is a Saturday. And we'd love you to come out to Buffalo. It's a beautiful time of year to be out here. The football's going on. If you're a Bills fan, we're very excited about it. But the weather's going to be beautiful. The leaves are going to start changing colors. And we're going to teach everyone how so many people in this country can be helped with minimally invasive implantology, our one-piece implant, both the minis, the mono, and the milos. So make it a point to come by Buffalo, get 16 CE credits for attending, and we'll teach you how to increase the revenue at your practice by placing mini and mono dental implants. We hope you have an unbelievably great week placing mini implants, and we look forward to seeing everyone next week on the Monday Morning Minute.